Hello F4C. This is Jatin Sharma and I'm your sports physiotherapist. I've been with youth teams earlier, and this is the time I will be talking about some important topics for your health, for your well-being, and general things which you can do on field to prevent injuries, to take care of your own injuries. Okay, so let's start with the some most important, you can say, tips to take care of when you're on the field, when you get injured, when you have some small or like major injury. The first few things which you need to do is the you can say on-field management. So our on-field management, you can say after an acute injury is something which happened just recently. For example, you are playing and your ankle got twisted, or you got hit by any other player by his like leg, or you fall down. It can be anything. Okay. So the first few steps you need to do is the acronym POLICE. 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 Okay. So what does it stand for? P is for the protection. First of all, you need to protect the area. Okay, whatever part is injured, whatever area is injured, you need to protect it to it from getting injured again first. Okay. Second thing, you need to protect it for the further injuries. Okay. So how you can do that? So there are multiple ways to do that. First thing is the strapping. Okay, you need to wrap it like if your ankle is injured. What we do usually as a physiotherapist, we wrap it up with the help of a crap bandage or some like you can say K-tape or other things, so that it gives the extra support and there is lesser chances of getting it injured again or like roll it down again on the field. So first thing is to protect the injury. Okay. Second thing is about optimal loading. POLIC, as we talked earlier about the acronym. Optimal loading means you don't need to immobilize it for the longer period of time. For example, what happened usually in earlier times, whenever you get injured, doctor used to say take rest. Okay, but it is not recommended right now. Like in the recent you can say studies or researches, it has been shown that if you give it the loading little bit like progressively from the starting at when you get injured, and you try to load it slowly but effectively, not that much that you injured it again. But you can say if you have injured your leg, okay, if there is not much swelling, then you can start walking and loading it gradually so that it adapts and the pain gets relieved. Okay, so the optimal loading is now, okay, say advice. Optimum can be like you can say it can vary to the condition to condition, but the loading is the main factor which is required, and that's how you get back to the sport earlier than what it is. That is the usual time frame. Okay, the other three things are very common which we use. That is the first I for ice. Okay, after an injury, we usually ice the part for 10 to 15 minutes of duration. You can use ice packs. You can use sprays to like you can say give the cold effect. But the idea is to reduce some pain by the help of the ice and to relieve it from the pain. These are the two common ideas which we work upon when we are using ice. Then comes the C for compression. Compression is again if there is a profuse swelling around there. For example, if your ankle got twisted and it is swelled up. Okay. So what we need some compression around the area so that the swelling does not, you can say, spread to other areas. Or it, like if the swelling is a lot, then it can cause pain and it can impair the function. So what we usually do, again, the crap bandage comes a role. Okay, you can wrap it by the compressing it. Always remember, do not try to compress it so tighter that it affects your, you can say, blood supply. Okay, just try to wrap it up as adequately to compress the area and give it a compressing effect. Okay, so C for compression, and the last is the elevation. So elevation, if it is a lower limb injury, like for example ankle, knee, or your foot, toes. So what we usually do, like while if it is a fracture or if it is an grade 3 sprain, which is like your like ankle got twisted very severely, then what we do, we usually keep it in an elevated position. For example, if you're sleeping like this, like then while sleeping, you can keep your leg up so that it helps to drain the you can say fluid around the ankle. So it last part is the elevation part. So this is the acronym which we need to take care when there is an acute injury, okay, always follow these things. POLICE, police. Police means P for protection, O for optimal loading. Start gradually loading as you feel that it is okay to load. I for ice, use ice for pain relief and other, you can say, to reduce the swelling, obviously. And C for compression, try to compress it with the help of any bandage which you can like wrap it around the ankle or around the knee. And the last one is your elevation. Try to keep it in elevated position so that you can drain the, you can say, fluid while you're sleeping. So yeah, these are the steps you can take when you are when you are managing an acute injury. And I hope this is helpful. I will be coming with some few more topics to discuss about how to manage specific injuries and what to do when something happen as a case scenario. And yeah, thank you so much. Okay, so let's discuss about muscle cramps. Okay, this is one of the most, you can say, prevalent thing in the football matches. Everyone experiences muscle cramp after playing for so long. Like in the second half, usually it happens, and you feel like your muscles are getting suddenly while they're running, or like when you are very tired, you feel that your muscles are cramping, especially lower body muscles like your hamstrings, your calf. These are the common sites of muscle cramping. So let's start with what happens at the muscle. Okay, first of all, your muscles are the contracting, you can say, machines, which helps to you to move around, and you like when you're running, when you're doing any movement, your muscles are at the key, you can say, actor, which are playing a role. Okay, so those muscles usually need, you can say, food to function well. That is your like carbohydrate, that is your banana, whatever you are eating, it is getting fed to your muscles, and your muscles are like constantly moving and utilizing that, can say, source of energy and doing the movement. So what happens when you play for a long period of time? For example, if we are playing off more than 45 minutes of game in a hot temperature where the demand on your body is already high. So what happens if you're not fed enough, if you have not taken food enough prior to the match, or you have played so many matches in a row, that energy source is getting depleted, and because of that depletion, usually what happens, your muscles cramp and they stop functioning at that moment of time. So you feel that something is so painful, or some you're not able to move, or usually you fall down, okay, on the ground. So that is a condition of a muscle cramping, and it is usually caused by, you can say, loss of energy sources in your muscle, okay, in a condition where you have not fed enough, okay, where you have not taken food enough, you will usually see in those cases. And along with that, if there is profuse sweating, that is a hot temperature and you are sweating a lot. So that these are three, you can say, predisposing conditions which can lead to a muscle cramp in a match. Okay, so you need to take care of these three things. First thing is that to prevent the muscle cramp, we will talk about how to manage the muscle cramp in on field, but to prevent it at the or any cost, you need to focus on your diet. That is the pre-match work. You can say pre-match food. That is like you need to take banana. That is a good source of, you can say, potassium, calcium, magnesium. These are the, you can say, this provide your muscles enough source of electrolytes to work and function well. It also is a good source of a carbohydrate, so you can use it before the matches. You can have some half an hour before. You can have your bread, jam, all these things. And before 2 hour of match, if you are playing in afternoon or evening, at least 2 hours before, you need to have at least good amount of food, that is majorly carbohydrate, and like rice and all those things you can have. So that's how you can load up the energy for the match also. And if it is a match in the morning, then you can eat like a good amount of food in the dinner itself, so that your body gets filled up with the food and you are ready to go in the morning. So these are the few things. And second thing is your water content. Keep drinking water before a match. Okay, don't try to overdo it because you will feel low a lot of then after that. But yeah, at least before 2 hours of match, just try to have enough water. And enough means like 250 ml per hour or half an hour you can take, and that is like, you can say, adequate amount. but have enough water. Second, have enough food. Load up the food before the match, so you don't feel fatigue during the match or after the match. Okay. In the halftime, try to have some banana or drink electrolytes or water enough. Water is most of the time enough, but if you are sweating a lot, then you can use electrolytes. Okay, so these are the three things we need to take care of while talking about the cramps. Now, let's talk about the management. So, like usually, when it happens, when is the cramping is happening, you will like recall that whenever you are running, okay, when you are doing a max out effort in the after the half time, usually that is the time when most of the players get cramp. Because what is happening, first thing is that you are exerting your body, okay, you are pushing it in a short period of time. Second thing, it involves a lot of, you can say, strong muscular contraction, and that is the time when your muscles are in the positions to get cramp most. And you will see most of the players cramping at that point of time only. When you are trying to overdo something and when you're trying to sprinting suddenly, those are the times which you feel cramp. Okay. So what to do at that time? What is happening? Let's understand what is happening at the muscle. First of all, muscle is getting contracted. For example, this is your biceps, and let's imagine this is a hamstring. Okay, this is your knee straightened. Now, what happens? Cramping does this. It constricts a muscle. Okay, it makes it shorter. So what you need to do, you need to reverse this position. So you need to stretch the muscle like this. Okay, so what we do on a ground whenever when a player is cramped, physio usually runs or players are usually help the person to first to feel calm. Don't try to panic because it will lead to more cramping and more feeling of pain. Try to lie down on a back, okay? Then you slowly stretch the muscle. Don't try to stretch it fast, okay? If you do it fast, then it can lead to more, you can say, contraction, and it can cause more pain. So the goal is to stretch it slowly and hold it for long period of time. Two things are important. First thing, to stretch it slowly. Try to hold the muscle and try to hold it slow and in a position where the person feels comfortable. Okay. Second thing, keep the knee straight so you feel good stretch in your hamstring. Okay. And if it is in a calf, try to try to push the feet upwards towards the knee so that the person feels stretch in the calf muscle, and then hold it for at least 15 to 30 seconds, at least minimum. That is the time limit. If it is, and then you can repeat it again and again. So that's how you can stretch it properly. So this is the thing. First thing, try to prevent it by having good food, electrolytes, and all those things. Second thing, if it happens on the ground, don't panic. Okay, try to stretch it slowly, stretch it and hold it for 15 to 30 seconds. After that, if it is getting well, drink some water, drink some electrolyte, move around, and you are good to go again. But if it is not getting resolved, if you are cramping again, try to come out because it's better to not get injured while cramping and you are playing again. Try to get some rest. Okay, have some food, have some banana, and then you can, if you feel good, then you can come back and play the game. So, but the goal is to prevent it in the first place, and if it happens, try to manage it with the food, electrolyte, and if it doesn't get better, take some rest and prepare yourself for the next match. So that is the whole thing you can do about muscle cramping, and it is a very short, you can say, short condition, and it gets usually managed easily. But the key things which I want to take from this video is that first, always prevent it with the help of food, and second, don't stretch it fast. Okay, stretch it slow and hold it for a long period of time. That is all. Okay, then this was the short video on the muscle cramping, and I will be coming with a lot more many videos on this. And thank you so much.